Hello, this is News You Can Use from Swedish. I'm Dr. Jay Fathi. I'm a family physician and the medical director for primary care and community health at Swedish. One of the prominent reforms and innovations that's occurring is a redesign in the way healthcare benefits are administered. In the past, really for lack of a better term, people were just given a card if you had healthcare insurance and you were told, we're your employer and we cover your healthcare. You can go wherever you want, and for the most part you might have a little copay here and there, but it's free and get the healthcare that you want. That system is economically very unviable. It leads to very, very high cost. And so what we're seeing now already, and we're doing at Swedish, is we're redesigning our benefits to really try to engage people, to get them to think about the healthcare that they need. I think moving forward, we're going to see much more of a focus for people to get their primary care and preventative care, which makes complete sense. And it's ridiculous there hasn't been a focus on that before, up to now. We all should be going to see our primary care providers annually to get our blood pressure checked, to get screened for things like diabetes and high cholesterol if that's needed for us, to get our cancer screenings done, which are based on age and family history. These are all things that are really going to be pushed because for any of us, we don't want to end up in a hospital with a stroke or with advanced cancer. We want to get things taken care of before they get to that point, or prevented if they can be. One of the prominent reforms and innovations that's occurring is hospital and healthcare system affiliations. One of the catalysts for that is about patient safety. If I go see a doctor or at a hospital, I want to make sure that information is available to my regular doctor and my regular care team so they can help coordinate my care, and that's what every patient should want for themselves and for their family members. Electronic health records is now the way to go. This is the future. Paper records are much more inefficient, unfortunately, and with hospital and healthcare system affiliations, patients can get much safer care and it's much better coordinated. Another innovation that's occurring is the introduction of nurse health coaches. People with a lot of medical problems and medically complex needs oftentimes need a lot of help in learning to understand what they have, how to manage their diseases. You don't get that enough from spending 10 or 15 minutes with your doctor, however well-intentioned your doctor is. Nurse health coaches can kind of become like a guardian angel or a patient's new best friend and resource. They can communicate with the patient over email. The patient can email them with questions. They take phone calls and do telephonic coaching with the patients. And oftentimes they will go to the doctor's appointments with the patients and help the doctor and the patient create a care plan. And then they can follow up with the patients so they really understand what the care plan is and what their disease is and what education they need to really try to manage that disease. Swedish has begun to develop and implement nurse health coaching programs, and we're going to see much more of that across the entire region. Thanks for tuning in to Swedish's News You Can Use. I'm Dr. Jay Fathi, Medical Director for Primary Care and Community Health. Hope you tune in again. Thanks.